Hey, good afternoon and welcome to the Winning at Wellness webinar. Today's presentation is titled Taking Action, Implementing CDC's Whole School, Whole Community, Whole Child Model and Local School Wellness Policies, presented by the California Local School Wellness Policy Collaborative. I'd like to share some housekeeping reminders and information before we get started. Audio connection is through your microphone and speakers of your computer or mobile device. If you're having audio difficulty, click on the arrow next to the mute button and select test speaker and microphone. Simply follow the prompts to connect to audio. And please keep your microphone muted to eliminate background noise. And time has been reserved at the end of the presentation for questions and answers. And a link to the webinar recording and PDF of the presentation slides will be emailed to you. And please use the chat box to submit your questions to the host at any time during the presentation. Like I mentioned, this webinar is presented by the California Local School Wellness Policy Collaborative, but more specifically, the Whole School, Whole Community, Whole Child domain of the collaborative. We have some of these domain members moderating today's webinar, which includes myself. My name is Farrah Northcott with San Bernardino County Superintendent of Schools, Paul Tabarez with CalFresh Healthy Living, UC State Office, and Kristy Weber is with the Alliance for a Healthier Generation. Our objectives today are to understand the CDC's Whole School, Whole Community, Whole Child model, acquire practical, actionable steps to effectively implement the CDC's WSC model within the local school wellness policy, and identify supportive resources for implementation of the WSC model within the local school wellness policy. Before we get started, I'd like to share a little bit about the California Local School Wellness Policy Collaborative. Our vision is to inspire school communities to take their wellness policies from paper to practice, and we empower school communities and partners to strengthen local school wellness policies and systems in California to support student whole child health and academic achievement. We are a partnership of wellness leaders that provide evidence-based resources to empower schools and communities to implement local school wellness policies and practices that support the whole child. I'm incredibly excited to introduce our speakers today, Dr. Marlene Schwartz and Dr. Kathleen Williamson. We have an amazing hour ahead of us. And as you can see, these are highly distinguished speakers today, and we're so thrilled and honored to have them with us. So again, please welcome Dr. Schwartz and Dr. Williamson with us today. And without further ado, we will get started with the presentation.
Wonderful. Thank you so much, Farrah, for that great introduction. And we are so happy to be here with you today. Just to introduce a little bit more about ourselves. So Dr. Schwartz, my colleague here, is the director of the UConn Red Center for Food Policy and Health. The website is right there for you. The Red Center is really focused on promoting solutions to food insecurity, poor diet quality, and weight bias through research and policy. We have another UConn center that's heavily involved in this work, and that is the Collaboratory on School and Child Health. The Collaboratory really focuses on facilitating innovative and impactful connections across research, policy, and practice to advance equity in school and child health. And that collaboratory is led by Dr. Sandra Chafoulias. And then finally, we have our CT WSC partnership. So we are very happy to share with you that we've recently received 5 years of funding from the CDC, the Division of Adolescent and School Health, and their Healthy Schools Office to work on WSC implementation. So we will be using the WSC model to drive statewide professional development in the state of Connecticut, as well as work closely with a priority school district. So that project started this summer, and really it builds on several years now of work and collaboration between the Red Center and the Collaboratory. And we're very excited. We actually just came back from the training in Atlanta where we worked with the other 20 recipients of this grant. And there'll definitely be some great work happening across the country with the CDC funding. So we're very happy to be here today with you. As I There we go. So let's jump into the WSC model, why we're all here. So this is our beautiful WSC model, lots of bright colors. As you may know, this was released in 2014, so we're just about coming up on its 10th birthday. It is CDC's framework for how we address health in schools. And when it was developed jointly by the ASCD and the CDC. And really, we know that this model shows us the connection between health and learning. Healthier children learn better, they grow stronger, and they become healthier adults. So we really want to emphasize that connection across a number of different aspects of school life. And when we think about this model, we love how pretty it looks. It's a little complex though, so we like to break it down. That's how we think about it. So when we break down the model, we like to first start in the center. So we have the child in the center, our students that we're working for. So everything is focused on the development of the students because the outcomes we want are safe, engaged, supported, challenged, and healthy children and adolescents. Everything is focused towards that. And the model, the CDC calls these the 5 tenets of the WSC model. Around the child, we have these 10 domains or components. So these are the different aspects of school life that contribute to having our children develop in this whole child way. These are all equally important in creating a school environment where children feel safe and engaged and healthy and challenged. And these areas are really all different ways that key groups in the school setting can contribute to that main outcome that everybody's working towards. And then we have everything, this big circle, situated within the community. We know that our schools always exist within a community context, and we know that the community is critical when we select, implement interventions and initiatives, and the community is critical for sustaining that work over time. So we really focus on the community piece with this WSC model. Another important aspect of the model being situated in the community is that it's contextually flexible, right? So the needs of the school and the community in which it resides is going to be different and diverse based on what that school and that community needs. So there's flexibility built into this model as well. And then lastly, there's this inner ring. It's almost a little bit hidden. It could be easy to miss, but this is where we actually see the magic happen. That's what we like to say. So the inner ring is what it's all about, because we all agree on these things and how important everything is, but how do we do it? We have to really focus critically on the coordinating policy, process, and practice. So our policies, what we have written down, our written foundation, our guidelines for our district that sustain us. Our practices, what's happening every day, what you see when you walk into the school building, and the processes, the plans or the roadmaps that kind of make it all happen. We really need to focus on coordinating these efforts across the domains with the input from the community to work on that whole child development. And again, this is where the flexibility as well comes in, because we're coordinating for the school and its needs and priorities. So that's how we like to break down the WSC model. And now I will turn it over to Marlene to take us through our first tool that we're going to focus on today.
Thank you so much. And I'm really delighted to be here with all of you. So, there's policies, there's practices, there's processes. So I'm going to start off talking about policies. And this is something that I started studying really almost 20 years ago. So those of us that have been around the school wellness world for a while might remember the 2004 WIC Reauthorization Act, where federally there had been an effort to actually change the competitive food nutrition standards that failed. And so the compromise was to add something to this act that was actually originally about WIC, not school meals, but saying that every school district needed to have a school wellness policy. And they needed to be in place by July 2006. And they had these elements about creating a committee, setting goals for nutrition and physical activity, having nutrition guidelines for all foods available during the school day. You had to basically say, yes, I am following the reimbursable meal regulations, and then you needed to have a plan. So it was almost as though we can't regulate competitive foods, but we're going to make each district at least say how they are setting guidelines for their own competitive foods. So that was the original federal regulation regarding wellness. And then a while later, with the Healthy Hunger Free Kids Act in 2010, some of these rules were updated. So new policy elements had to be added by July 2017 that really tried to, kind of give it a little bit more teeth. So having someone in each school who oversaw compliance, making sure you really were including a range of people on your committee, using evidence-based strategies and techniques. That finally, we had competitive food nutrition standards called SMART snacks. So these needed to be put into place, and only those foods could be marketed in schools. And then finally, triennial assessments, this process that was supposed to happen every 3 years, where you assessed your policy and you sort of took inventory about what was in your policy, how it compared to best practices, what was being implemented, and where you could work on making improvements. It was originally due in 2020, clearly got put off for a year or two, or even 3 in some states. So this was when that first WIC Reauthorization Act came out, and there was suddenly going to be all of these policies written all over the country in every single school district, that I applied for my very first grant, which was to develop a measure to assess those policies. And this was really, having studied the school food environment for a while, and really interested at that point in how we could make it as healthy as possible, worked with a national group of researchers to come up with a research measure that would allow us to give a quantitative assessment. So we wanted a number, because we wanted to then be able to compare the strength of the policy to the practices that were happening in the schools. So the first measure that came out was in 2009. This was funded by the Robert Wood Johnson Foundation. And then after that came out, we saw there was a lot of interest in the field, that people wanted to be able to measure their own policies. So we created a website, the original WellSat website, and we got it down to 50 items instead of 96. We worked with a sort of multi-stakeholder team to get that done and put it online. And then we sort of kept our eye on the ball and how things were changing around the country. So when the Healthy Hunger Free Kids Act came out, we needed to revise it. And then when the 2016 regulations kicked in, we revised it yet again. And so we're now at WellSat 3.0, which is 67 items. And so it was really designed originally around what the federal government was requiring. So it continued to be nutrition education, nutrition standards, physical activity, that implementation. And we wanted the scoring to kind of work in 2 ways. We wanted to really focus on having strong policies. So as I'll explain in a little bit, there's a way of scoring that can tell you how many policies are really written with sort of clear language where you know exactly what's going to happen and it's required. But we also wanted to give districts credit for at least trying. So even if they had some language in their policy that was more of a recommendation or aspirational, we wanted to at least give a point for that. And so we consider that comprehensiveness, like how many things do they actually cover in the policy, and then how many actually have that really sort of strong language. So over the years, the research has been building in terms of whether or not having policies matters. And these are just a bunch of studies that have come out over the years showing that indeed it looks like they do, that having stronger policies has been related to BMI and weight-related outcomes, increased fruit and vegetable intake, decreases in the availability of soda, candy, or other empty calorie foods that would be pre-SMART snacks. I did a study showing that the stronger your policy was, the better the implementation. And then it's also been shown to help with the amount of physical activity if you have strong policies about that. And this is what a lot of the policies, I've looked at hundreds of wellness policies at this point, and a lot of them look like this. They really, to have the committee, and they have a section on nutrition, a section on physical activity. But then the WISC model comes out in 2014, and we started getting familiar with that and realized that there's 8 other domains that really weren't being assessed by the tools that I was using and people in our field were using. And so we thought, okay, we've got the WellSat 3.0, we've got the WellSat, we've got the, sort of items there you can see that we address, and then all the other things that were being left out. So the idea came with some colleagues at UConn, namely Sandy Chafulius, who Kate mentioned, who is in the NEAG School of Education and runs the Collaboratory, that what if we work together and we try to take this tool, which at this point was being used by a lot of people across the country, and add the other elements to it so that we could really capture the whole WSC model. And so basically what we now have are two different evaluation tools. There's the original WellSat 3.0, which still got used a lot, especially in the last couple of years as people have been doing their triennial assessments. And then this expanded WellSat WSC, where we have created subscales to really capture the entire WSC model. So today, I'm just going to talk some about kind of where you can find this on our website and how you can, try it out for yourself. So we have what we call the WellSat Suite, and there was a little arrow pointing to where you can click to get to this measure. Thanks. And so the way that we developed it was it took a little bit of time because it's a really big model. But we came up with a matrix of all the key concepts that we felt were on the different domains that were on, sort of the 10 components of the model. And this was a team of, Sandy and me and some graduate students looked at the national organizations that study those specific things. What kind of guidance did they provide? We came up with some preliminary items. We then went through a process with a series of experts from each of the domains to review it. And then we revised that. We did cognitive pretesting, which is where we sort of worked with some people who would be using this either in the Department of Education or food service directors, and made sure the questions made sense. We came up with our coding and scoring guidelines and then pilot tested it. And we have published the results of this process and sort of all of the backgrounds of how we came up with the items. So the final measure, if anyone is familiar with the WellSat 3.0, looks a lot like it, but has the additional domains. So we have each one listed at the top, and we tried to keep it as short as we could because we knew that it was really overwhelming, but it was a lot of material to cover. So it does have 116 items across the 10 domains. There's also what we call the 11th scale, which really gets at more of that coordination and integration of policies. And then the items in the exact same way are scored 0, 1, 2, and result in strength and comprehensiveness. And I will say, we don't necessarily recommend that anybody sit down with your hundreds of pages of district policies and try to do this whole thing at once. Don't do that. This is really designed to be done in stages. And maybe if you have done the WellSat 3.0 first, you can transfer those scores sort of into this part of the site, and then we take one at a time. So sort of pick a domain that you want to work on, get the policies you think will be relevant to that domain, and then start working through that. And I think it's a process that you can take your time with, and it should map onto what your priorities are as a school wellness committee or district level school committee for the particular time that you're working on this. So in terms of the coding, and this is very much the same as WellSat 3.0. So the 0 basically means we could not find anything in the policy that had anything to do with this item. So if it's completely missing, then you get a 0. If you say something about something related to the idea of the item, but it's either written in this sort of vague or confusing way, if it's listed more as aspirational or suggested, then it would get a 1. If there's somehow a loophole, like it feels like that it would be easy to not actually follow the policy because of the way it's been written, or if it mentions something happening in the future. All of those are things that would be rated as 1s. And so the words you would look for might be things like may, can, should, might, encourage, etc. You can see the list there. So that's how you sort of would recognize kind of a weak statement. Like you get credit for putting something down, but it's not necessarily something that you know what will happen. So on the next slide, the 2 would be sort of the stronger coding. And that is basically when it's clear the policymakers are committed and they're using sort of strong language. So things like shall, will, must, etc. And it's also has often something that is scored as a 2 will just have some like details in it. So like, for example, I mean, the example I typically use is, food as a reward in the classroom, like something that says, we encourage teachers not to use food as a reward in the classroom would be a 1. Saying the use of food as a reward in the classroom is prohibited would be a 2. And so the question I would often ask myself is, if a parent was reading this policy, could they predict what was actually happening in the school based by what was, written in this policy? We got ourselves into a little bit of a corner with things that we wanted in the policies, but that were really hard to mandate, like teachers role modeling healthy behaviors. So we felt like as long as they were very clear, like we shall encourage teachers to role model these behaviors, that would also count as a 2. But this is where it gets a little bit tricky, where you have a combination of words like shall and encourage, because one is strong and one isn't. And we'll see some examples of that.
Exactly. Thank you so much. So now let's jump in and do some practice, right? We have picked a handful of examples to practice with, and we picked some of those other domains, not your traditional nutrition and physical activity. We actually picked some of the other WSC domains to practice through. So what we're going to do is we're going to look at some sample policy language and practice using that 1 and 2 differentiation and see how we do with that. So what we'll do on the next several slides, just so everybody's aware and ready to go, is I'll show you the item from the domain and the item we're looking at, and then the scoring criteria, what's a 1, what's a 2. Then we'll put up the policy statement, the sample statement, and then everybody will have a minute to take a look at that, put their 1 and their 2 in the chat, and then we'll show the answer and go from there. So we'll do a couple practice ones. Here we go. So our first one is in the domain of employee wellness. So the item here is about addressing methods to communicate information about and encourage participation in available wellness programs for your employees. You'll see here, the 1 versus the 2 really comes down to what we were just discussing with the recommendation versus the requirement, right? So let's see the statement language. All right, I'll give everybody a minute to take a look at that. And once you think you're confident in your rating, go ahead and put a 1 or a 2 in the chat. All right. Oh, there we go. Everybody is right there, right spot on. Absolutely. This is strong policy language that we would have earn a 2, right? Because we've clearly designated this champion to take care of this communication piece. No vagueness here. If I walked into the school, I could see who the wellness champion is and what emails they've used to share that information out. So we've got a nice strong 2 here. Excellent. All right, our next practice item is in the domain of social and emotional climate. So here we are looking at school climate surveys. A 1 rating would be about recommending participation in some school climate surveys, and 2 would be requiring participation in school climate surveys. So here is our statement. And let us know, do you think this is a 1 or a 2? Well, everybody's fast on the keyboard here. Excellent. Yes, we would definitely say that this is a 1. Oh, 1 there. So here in this example, we are really only suggesting, right, should regularly participate. To move this to a 2, or if we saw a policy language that might be a 2, might say, will participate in annual school climate surveys. That would certainly shift us more to that 2 rating. And then I think there'd be even more bonus points, so to speak. There's only 2 points you can get. But if you said who those key groups were that would participate in that annual school survey. So those are just some examples of the differentiation of the 1 and 2. All right, family engagement. So this item addresses opportunities for ongoing and sustained family engagement throughout the school year. Again, the 1 versus 2 difference in the scoring criteria comes down to recommending and requiring. So here's the statement, or here's the policy language, and go ahead and throw your 1 and 2 ratings in the chat. Okay, we've got some mixed ratings on this one. Okay, some 1s and some 2s. So we would rate this as a 2. This idea of having the quarterly sponsored events has that kind of marker in the sand, this goalpost of what is required, that there's going to be the quarterly offerings for our families. So it moves out of that recommended and vague language of a 1 and does kind of shift into where we would give that a 2 rating. And in my mind, I almost give it a little extra bonus. I love that they say the wellness will include the whole WSC model for families. That's great to see. But that's where we actually see that concrete action that's being put in policy language. And we would be able to go into the school and see, yep, that's happening. That meets that policy. Those quarterly events are happening for families. Excellent.
Would you
Okay.
mind skipping through the next example, and I'm just keeping my eye on the time, and we can go to the navigating the system slide.
Absolutely.
Thanks.
All right.
Great.
Take it away.
So here's the website. And if you go ahead and click on that, it'll take you to the sort of front page. There we go. And again, if you've used the WellSat 3.0, it looks just like this. And you can use your same login account if you already have one for this measure. But if you don't have an account, you can click here to register, and you just put in your email and a password. It'll start working right away. You don't have to wait for it to like email you something and confirm it like some websites. And then once you're in, you will decide if you want to just do the WellSat 3.0 with the sort of traditional policy areas, or if you want to use the WSC domain. So you click that. And then this page is where you put in the information about your school district. So we just did an example, West Hartford WSC assessment 23-24. So you want it to be something descriptive that you'll, remember where it is that you're doing the whole WSC model and the year, because that helps you keep track if you're going to be doing this over time. If you do happen to know your NCES number, you can put that in, or you can use these drop-down menus with your state, county, and district, and it should all populate. If you're in a private school or or a district that isn't in their regular database, then you can just go ahead and select just kind of put in the name of the district that you want. So then you put in what year it is and click ahead, and sorry. And here you'll get to a page where you can decide which elements of the tool you want to use, which subscales. And as I mentioned before, you can copy your WellSat 3.0 scores over here. And so you don't have to do those again. And then this is where you would add the subscale that you want to work on at that time. And I would recommend me picking one to start with. And so here we picked social emotional climate, and then it will go through and give each of the items, and you sort of read the item. If you click on that little question mark, it will then pop up with the coding criteria. and you can then score a 0, 1, or 2. We do have a not applicable always available because for a variety of reasons, the question just may not make sense in your local education agency. And so you can always just pick that. And then when it calculates your strength and comprehensiveness score, it just adjusts the denominator to a smaller number of questions. And then on the right, you can see the modules that you've picked, and you can kind of jump around. When you go back in the second time, and this is, I know this confuses people because people somehow can always find out the contact us button on their site, and I'm the one who gets those emails. So people sometimes can't find their policy that they already coded. So if you look at this page again, it says complete a new policy assessment or look below to see your scored policies. You have to look below, and you'll see my policies, and then it will have the name of whatever policies you have coded in your account. And you can just click on that. It's a link, it's red, and it should take you right back in. And what's nice about it is you can add more subscales at that point. And so you can decide to do additional subscales. You can also change your answers. So if you've gotten more information, or for whatever reason the policy got updated or something, you can change the answers and it will update it as well. And these are some of the resources that are available on our website. You see the link at the bottom. There's a little video explaining how to use the website. There's a podcast that Sandy and I recorded talking about the development of the measure. We have some, sort of written briefs. There's a user manual and coding guide. So if you're the type of person that likes to print everything out and have it in front of you, it's PDFs you can download and print. And then there are also score sheets. So it's a little bit, I feel like this, even more than the regular WellSat, is really kind of a team effort, because chances are there's not one person in a district who's going to know where to look in every policy to answer all of these questions. So I think either doing it sequentially and having different people work on different subscales and sort of add it on, or having, groups of people sit down together and maybe even do it on paper first and then enter it into the website just so you can get your scorecard and track your scores that way, is another approach that might work.
Wonderful. And so here is actually a quick snapshot of all of our WISC tools. So we just spent time going over the WellSat WISC there, as you can see. And these are all the tools developed either by the Red Center or CSCH. And as we transition from assessment, you might be thinking, then what do I do with that assessment and those results? How do I take those and put things in place and strengthen my policies? And that's why we actually developed what you see over on the right side of your screen. We call these the blueprints. So that's what we'll spend our remaining time introducing to you, so that you can also take that, put that in your toolkit, and look further into our tools. So really, we want to think about taking the assessment and moving to action planning when we're thinking about that inner ring there of the model and the coordination pieces. So we have the WISC blueprints. So these blueprints answer that how question. We really found in our work over the years that the what makes sense to people. Everybody is on board with whole child development, all the different domains that are important in the school setting and the community input, but that's a lot and it's complex. So how do we actually put this in place in our policies and in our practices? So that's what these blueprints are. They are tools to help you do that. These are a couple pieces here that are important about these blueprints. They're grounded in theory, which I'll touch on in a moment. They're as user-friendly as possible. We really wanted to focus on having these be tools that you could pick up and use right now. And perhaps most importantly, they are freely accessible on our website. All of our resources are there for you to support use of the blueprints. You'll see here too that there are two pictures. There's two blueprints, policy and practice. So when we were developing the blueprints and thinking about the model, we really thought about how we're speaking to two different audiences, right? So typically in schools and school districts, policy kind of lives at the administrative level. There's your school-based administrators or your district level administrators, and the practices kind of live more on the ground in the schools and the people who are implementing the practices every day. So your administrators and then your teachers and service providers, et cetera. So we really wanted to speak to the two different audiences in that way. And that's why we created two different blueprints. And a lot of time went into this, actually 4 years of development to make these blueprints. And they speak to one another in that they are parallel in format and construction. So we do recommend that schools and districts consider policy and practice together, as policy outlines what's supposed to be happening and practice represents what's actually happening. So you want to have those two pieces coordinated and integrated. But we have these two separate blueprints so that you can take the time to focus on those two different aspects. So we will be talking about the policy blueprint. The policy blueprint really leads school and district leaders to develop action plans for 1 to 5 changes to school policy that can strengthen equity and whole child development. So a little bit more about that. So another website screenshot. So this is where you can find them on our website, and we'll throw up the QR code and have all the links and all the slides that are going to go out to you later. But they are right here in the process page of our CSCH website. So this is what we call the blueprinting process. So I mentioned just a moment ago that the blueprints are grounded in theory, and we affectionately call this process the 3 E's: exploring context, evaluating directions, and establishing actions. This process is based on implementation science and what we know about how to set schools up for sustained implementation of initiatives and implementing those initiatives with fidelity. This process also draws on congruence theory, which emphasizes the importance of goodness of fit between the different culture, school structures, work, and people in the school setting, because the congruence of those pieces is really critical for initiatives to work. So that's where we developed this 3 E's process, and that is guiding the structure of the blueprints. One too many slides, there we go. We also leverage backwards design when creating the blueprint. So those of you who are coming to this webinar more from the curriculum side might be very familiar with the idea of backwards design, but we really wanted to leverage this idea in thinking about the blueprints, again, because we wanted them to be tools for you to use to create change. So we use backward design really in 2 ways when creating the blueprints. First, we thought about what are our goals for schools in using the blueprint, and then how can we assess progress towards those goals? And then backing up even further, what activities are going to facilitate progress towards those goals? And then perhaps even more importantly, we designed the entire blueprint so that your work centers on the end goal of the WSCC model, which is the whole child development. So you'll be led through a series of activities that allow you to identify indicators of whole child development that can be strengthened in your setting. And then after assessing feasibility and designing plans for implementation of these policies and practices, you'll end up with making those changes in your setting. So next up, I mentioned a moment ago that we want these to be user-friendly. So we really tried to build in some features for you. So first, we have a number of icons throughout the blueprints. So these little icons kind of give you some guidance. You know, here's where you're going to find your activity. Here's a tip, something to consider, or a resource that you can go and read to supplement your work on this topic, or some reflection questions that you might use to drive conversation in team meetings, and those sorts of things. We also have a really nice pacing guide built into the blueprint. So it's a flexible tool, but to help you get started, we want to give you somewhere to start, right? So we provided a suggested 10-session structure for moving through the blueprint. Each session includes some brief reading for background content and an activity. These sessions can be completed in a number of different ways. So for example, an administrative leadership team might take a whole school year to work through the blueprint, you know, 1 session a month maybe, and slowly develop their action plan to implement in the following school year. Or maybe an administrator would work over the summer and go through the blueprint, kind of individually, but tapping into their colleagues' expertise when needed in different parts and different activities. Or yet again, maybe you would take the blueprint sessions and kind of break them down over a 2-day administrative retreat, at the end of the school year or before the school year to develop your action plan. So there's flexibility built in here, but you have this pacing guide as a starting point for you. Too much. And then we also have some case studies and completed examples. So we know that it's very helpful as you're going through the blueprint to see an example come to life. So we have a case study that runs through the whole blueprint, and we have completed examples of all of the activities. So you can also have those for reference to guide your work as you go through the blueprint. So now I'll walk you through some of the sections you can expect to find in the blueprint, and then we will wrap up our time together with some Q&A. So here's what you're going to see in the blueprints. First, we have an introduction. So we want to make sure that people who are picking up the blueprint have the knowledge that they need to really go through the rest of the process. So with the blueprint introduction, we have content to help you build your knowledge about the WSC model and the different theories that went into creating the model and setting you up for success using our 3 E's. And then we jump into our 3 E's. So first up is exploring context. So in this first section of the blueprint, we really want you to focus on understanding your existing work. Where are your strengths already, and where might you have needs? Now, as you'll see at the bottom there, where I have the activities listed, this is really the section focused on using the WSAT-WISC to assess your policies. So by attending this presentation, you're already ahead of the game because you're all ready to jump in and to use the WSAT-WISC to assess your policies. And that's really the focus of this exploring context piece to the blueprints. And then you move into the evaluating directions. So after you completing your assessment, here you want to review the results of the assessment and figure out what are your priority areas for making changes in your setting. Again, this is contextual to your setting. So here's a little preview of one of the activities. So we call this our zooming into the individual policy level activity, where we ask you to identify one WSC domain to focus on and identify all of the policies that relate to that domain. So if the domain is social and emotional climate, you might have discipline policies, attendance policies, your school climate policy, right? And then consider the different potential action steps for each policy. Is there something that your assessment showed you, oh, we really need to strengthen our language in this policy? Or maybe, oh, our policy doesn't show that, but we're doing that. We've been doing that for 2 years. Let's put it in our policy and make it, get ourselves credit for what we've been doing and to make it institutional across the board, right? So this activity really helps you to zoom in to the policy level. So this is just an example for you to get a flavor. And then after evaluating directions, you move into our 3rd E, our E about establishing actions. So once you've identified your potential action steps, we want you to carefully consider which of those do you want to pursue at this time. And then you can develop your action plans and then finally make that link back to practice. Very often, if we're going to make a policy change, we might need to make a practice change or let people know that those policies have changed. So we want to make sure that those pieces are clear as well. So the last activity in the blueprint kind of ties those pieces together. And then I'll show you a preview of one more activity, just to give you a sense, because this is actually one of my favorites. This is where we weigh urgency and readiness. So when I said you want to identify your potential action changes, right? Because you could probably identify a number of possible steps to make, but you can't do everything all at once, right? You got to kind of focus in on what are your top priorities, where can you make change right now, and focus in. And the way we like to think about that is by weighing urgency and readiness. So readiness is about the ability to engage in a policy change, and readiness sets us up for successful and sustainable implementation. And on the other side of the coin is urgency, or the necessity for the change. And that urgency is what motivates us and motivates the other folks in our district or our setting to complete the work that's necessary to engage in that policy change. So this activity walks you through considering those 2 key contextual factors. And again, it's one of my favorites because finding that sweet spot of high readiness and high urgency is where you can really make an immediate difference when you're strengthening your policies and your practices. So that is our introduction to our WellSat WISC and our WISC blueprints. We think we have just a minute or two before we transition into Q&A, and I know we have a number of folks here in the webinar, which is wonderful. So if anybody'd like to share anything in the chat, something kind of a light bulb moment you had about wellness policy, or a colleague you've been thinking about who would love to see these tools, a way you're going to use these tools, anything like that. And of course, feel free to start sharing those questions as well as we get ready to wrap up here in a minute. And as you do that as well, please throw those thoughts in the chat, and I will share this with you as well, so you can take a picture of that QR code on the right there if you'd like to access the tools. As we are answering your questions as well, please feel free to provide some feedback on our webinar and our tools that we'll use to drive our future work. And with that, I think I will turn it over to Kristy and Paul, maybe to help us with finding some questions to answer for folks.
Yeah, thank you, Dr. Schwartz and Dr. Williamson, for the great presentation. And we do have a question right here in the chat box. Does the scoring guide for the WISC model have sample language like the WellSat? It is so helpful when revising the policy.
Yes, so I can answer that. It does. And so when we were developing the measure, we had real policies from real school districts, and we looked to find actual language, because we can, of course, make up the language that we would like to see, but it's much better if you put in language that a district has used. So as much as possible, we have added that information. But I also feel like that is you know, an evolving thing. So as, you know, as people use the tool and as we get more familiar with how all of these other policies are being written, we'll keep adding to that, because I think that's one of the things that probably changed the most as we were doing different versions of the WellSat, was just getting sort of better and better language to put in for those examples. I will also mention just one thing while I have the floor, which is, when I started doing this work, the fear was always that things would be written in policy that weren't getting done. And we've done so many studies now, especially last year with the triennial assessments, working with all the districts in Connecticut, that it's so much more often the opposite, that school districts are doing so much and there's so many great things happening, but it doesn't tend to get written down in the policy. So as much as it's important to sort of get it from the paper to the practice, I think it's important to get it from the practice to the paper, because once it's written in there, I think then it really, you know, is sort of integrated into the school district in a way that hopefully will really support sustainability and not losing that practice because, you know, the person who is really passionate about it has left or something like that.
Yeah, that's great to hear, because yeah, our local school partners are already doing amazing work, and you know, we appreciate that. Jenna also had a great comment. She mentions that it's really great to have a tool that combines the WellSat with SEL language. Schools have asked about this in the past, and we haven't had a lot to give them, so they'll appreciate this. Thank you for the comment, Jenna. And just to reiterate, there is, to ensure your the Winning at Wellness webinar recording, if you want that, you'll be able to sign up for the free newsletter, and Bailey has put that in the chat box for you as well. But yeah, we have a couple more minutes. If you have any other questions, please put those in the chat box.
Yeah, and while we're waiting, I'll also mention, you know, these are relatively new tools. So they're just starting to get used. And as if anybody on the call is trying them out and has feedback for us or recommendations, we're very open to that. And that's, I feel like, you know, super important, because we want these to be useful to the field. That's why we built them. So please feel free to reach out to us.
Awesome.
Okay.
Well, thank you for that. I don't see any more questions in the chat box. I can go ahead and turn it over to Kristy.
Thank you, Paul. Just wanted to invite everyone to connect with us on social media by signing up for our newsletter. We are also on Instagram, Twitter, and YouTube. On YouTube, you can also access this and previous Winning at Wellness webinars for your viewing pleasure. You can also email the collaborative here at this email address at the bottom. And there's lots of really great tools and resources to help you with your wellness policy creation. And just wanted to say thank you to our presenters today, Dr. Schwartz and I'm gonna call you Dr. Kate, well, Dr. Williamson. And thanks everyone for being here, taking the time in your afternoon. We really appreciate you hanging out with us today.